Good day and welcome to another episode of Fertility Talk with Olarunke Thaddeus. And today we'll be treating a very important topic as it concerns our men. Male infertility is one of the commonest issues when we are addressing fertility issues among couples. And the truth is 4 or 5 out of 10 cases of infertility are affected with male infertility. But today we'll be talking about azoospermia as one of the issues that borders on male infertility. About 40% of male infertility are affected by azoospermia. So what is azoospermia? Azoospermia is lack of sperm at all. Lack of sperm, zero sperm. So let me take you to the journey of how sperm is formed. The sperm is made in the testicles, and from the testicles it goes through the reproductive tract, and where it meets with the fluid, and both the fluid and the sperm are what make up the semen that you ejaculate when you have sex with your partner. So now imagine a situation where your semen does not contain sperm. I know you've heard cases of low sperm count where there is a small percent of sperm in your ejaculate, but when there is zero sperm count, meaning that there is no sperm at all. Okay, so if there is no sperm at all, what could cause this? I know you're interested. There are 2 types of azoospermia. We have the obstructive azoospermia and we have the non-obstructive azoospermia. Even from the word obstructive, this will tell you what this is all about. This means that there is an obstruction somewhere. Very likely some of the tubes that are meant to connect the male reproductive organs are disconnected, and this is causing obstruction, and this is making it difficult for the sperm to be able to be in the semen. This is number 1 issue that could happen if there is an obstruction. It could just be that there is a disconnection somewhere along the reproductive tract. There could also be congenital issues along the vas deferens, and that could cause obstruction, and also there could be infection. It could be that you've been exposed to some sexually transmitted infections, okay, that could cause you from having this kind of issue. To the non-obstruction azoospermia, what does this imply? This means that nothing is obstructing, but still no sperm is being produced from your semen. There are possible reasons why this could happen. Number 1 on my list is genetics. Some males have genetic issues. The normal chromosomal pattern for male is XY, but you find some male with XXY. Yeah, this is a big deal, okay? So it could just be genetic, then it could just be that some hormones are also affecting the sperm production. Some issues with the brain could also cause non-obstruction. Issues that affect your pituitary gland could also cause obstruction. Some medication also would cause obstruction. If you are exposed to radiation, if you are on chemotherapy, all these would cause obstruction. Abscess of testicles that do not draw, malformation of the testicles, all these also could cause obstruction. Another factors that are responsible for most cases of non-azoospermic are when you have done surgery, issues with your past surgeries that borders around your pelvic area or reproductive area, if you have diabetics, other things that could cause you to have non-obstructive azoospermia, reaction to medication, could be herbs, some guys, some males are fond of using herbs. It could be prior surgery done, your previous surgery. It could be exposure to radiation. It could be that you have diabetics. It could be that there is a problem with your brain. All these could cause non-obstructive azoospermia. How to detect that you have azoospermia? Very likely is always very impossible to know that you have azoospermia. In many cases, men with azoospermia get to know at the point where infertility sets in. So at that point, semen analysis is done, and from the semen analysis, the report shows that there is zero sperm count. So this is usually at that point when a lot of men gets to know that they have azoospermia. Another symptoms that you would observe is if you have erectile dysfunction, if you have low sex drive, if you have lumps around your testicles, if you have pains around your testicles. All these could point to it that yes, there could be a case of azoospermia. Okay, so how do you treat azoospermia? Depending on the type of azoospermia that you have, then treatment options will be made available to you. For instance, in many cases of non-obstructive azoospermia, doing IVF would help, and most especially with ICSI, intracerebral sperm injection, would help. And apart from this, a medical procedure can be performed to help retrieve the sperm from the testis. And in case of obstructive azoospermia, then we might want to look out for what is causing the obstruction. And once this is found, then surgeries can be done to correct this. And if it is because of hormonal issues, then you can be placed on drugs to correct some of the hormonal issues. So you see, the era of pointing accusing fingers to females has really gone. The truth is, a lot of males are affected with infertility, and their issues are enormous also. So it is very good as a couple to treat infertility together. It should be a joint venture. It should be a joint approach. As the wife is going for evaluation, the husband also should go for evaluation, so that both couples can be evaluated together. Then the results would determine the best treatment option at the end of the day. Thank you for joining me on today's episode of Fertility Talk with Olarunke Thaddeus. I beg of you to please subscribe to our YouTube channel and follow us on Instagram. And if you have personal questions or you want us to discuss any topic, kindly comment below. And if you want a personal consultation with me or with our consultants, then also you can call the number on your screen. Take care. Bye.